are putting here. Now, lastly, I would like to bring to your attention that currently there are around 300 to 400 interns and senior house officers. Senior house officers are doctors who are specializing, doing masters like in surgery, like in obs guide, you know, whose allowances, you see this contract that we say, all of us have this contract, but over 300 people are not being paid their 1 million shillings. It's now going to 8 months. It's now, this is the 11th month.
Including yourself.
Including me, myself. We don't know where our money went. We have gone to parliament. They said when they passed the budget, money was in the budget. We have gone to court. Court has refused to listen to our case up to now. It is now 3 months. But we are saying we shall not shed blood because we swore an oath to protect life. But court, please listen to our case. We signed these contracts as old people. We were sober. We need our money. We are not slaves to anybody. We need our money. This amounts to something like 4.8 billion shillings a year. And Minister of Health is asking for supplementary budgets day in, day out. By not putting this money into the supplementary budgets shows that the money was given to them. Because if really the money was not given to them, why can't they put it in the supplementary budget and ask for the money? So please, this is a war that you should fight to help your relatives whom these people are seeing. I'm talking on behalf of 2,245 interns who are distributed in 74 hospitals around the country. And I'm telling you, these people who are deprived of their allowances are all over the country. Let it not be your relative to land on a hungry intern. Please. So, with all those words, I'm sorry for my tone, because I'm the most affected among us the way we are seated here.
You are hungry.
Because I have not eaten breakfast. I had to borrow transport. That is the fact. That is the fact. Somebody may not believe it, but that is the fact. So, we need to pay the current people who are supposed to be paid. We need to put this policy at hold. We need to put this policy at hold. Make proper consultations. I don't see any reason as why you are taking this policy to cabinet. Because cabinet does not understand these things the way these people understand them. First consult them, then take it to cabinet for approval. Because you are going to take these wrong things to cabinet, and the cabinet will approve like it approved, and then we shall come back here. So please consult these people, and for now let us maintain the status quo. I have said this, I'm going to repeat it. There is no need to rush. The current interns are working under 1 million. Before you start thinking of providing people food, which food you don't have time to serve it, because no intern has a specific time to eat lunch. No one. Somebody will get time at 2, another will get time at 5 p.m., another will get time at 7 p.m. You can't serve them lunch at 1. Secondly, which lunch are you serving? Which lunch? Because people have their diseases now. Most of them, by the time they finish medical school, they have their ulcers, they have their what, they don't eat beans, they don't eat matoke. People should get lunch of their preference. Lastly, whom are you going to send money to buy this lunch? If you yourselves have failed to pay allowances of people, whom are you going to send money to buy this lunch? Who? Who in hospital are you going to send money to buy this lunch? Please, me, I have always told people that is a joke. We can't talk about facilitating people lunch as in lunch. People have different problems. So, with all those words, I would like to implore the Minister of Health, please, first of all, pay the current interns whom they are not paying. People need their money. People are not slaves. No one said to be a slave to you. Number 2, withhold this policy. Number 3, come back and make proper consultation. There is no need to rush.
The most affected people, the most affected people are the students.
Yes.
Let's give them just 2 representatives.
But then our doctor. avire ddala waggulu ng'atwadde Uganda naye ate oluzungu
nedda tujja bidda mu Uganda ejenvire mu Uganda. We have nothing to do. Let us give you content. Let's give you content. Just gather the content. You don't know what he's going to say. It might be the one which says.
I think is how will students cope up operationally? Like internship incorporated within academic program. How will students manage these demands of a training? Remember, if you're still labeled a medical student and you're required to work with a supervisor, let's say you're going to do a cesarean section, will my supervisor, Dr. Frank or Dr. Kawe, will come and supervise me yet I'm labeled a student? If a mother comes and it is an emergency and I'm a student, what is protecting me between me and the student and the patient, that they earn the trust that I can work on them and they go, because you're still labeled a student. So the justification is, let students graduate, then go for internship and give them allowances. Actually, the 1 million is very small, even to us the students, like in our setting where we go in communities. They put you like in Ginger, you can't manage the rent of Ginger and feeding for all that time. Now imagine you're a student still supported by your parent that you can provide that, but still it is expensive. What about you're going to do a 36-hour shift, you're coming back to your room, that they are demanding you don't have what to eat, and the government is putting them in pressure. Your supervisor is telling you have not done this and that. So I think there is a lot to discuss within this policy to make sure that it aligns with the demands of the real people that it affects. So the medical students, lastly, have an appeal to the government and the stakeholders that were involved in making this policy. One, we demand clear justification and transparent communication regarding this policy. It first came in rumors, in a New Vision. Then we started asking, what's wrong? They hid the information. So, as the people that are affected, the key stakeholders of this policy, we demand to know. Actually, they should have reached universities and told us, mostly they ask the already ongoing students, we are bringing this. How best can we overcome, and how best can we improve for you who are coming as interns? But it was never there. The other thing is, we call for an immediate halt to this rushed implementation. You cannot implement something that I didn't sign for a contract as I was joining medical school. Psychologically, students are all being tortured. When you talk to a student, instead of concentrating on reading books, actually these days, they concentrate on thinking about how their internship will be without payment, without welfare. Remember, the parents leave you at that moment to go and try the world. But the government is taking away the small portion. Yet, it is evident that it is interns that maintain most of the activity that is ongoing in the hospitals. Another thing is, we call that internship should be done after graduation without debating about it. Because what protects me is that I've graduated and I know I'm a doctor. But if I come as a student, I don't feel confident to practice, to even touch a mother and cut. But if I know I've graduated, inside I am forced to make sure that I learn and protect my job. Even these temporary licenses that are offered, you can't offer me, in the policy they say they will offer us temporary license, but you can't offer me as a student. You should offer me as a graduate, as a professional that has graduated. Then we also urge a written, a structured negotiation with all relevant stakeholders. Since this policy came out, we have been writing to the ministry and other stakeholders to call us and discuss these concerns, but no attention. We come in the media, we complain, but there is no attention. Now it seems we are irrelevant. But when you reach in the hospitals, the most work is done by these interns. That is evident. So we call that they call us on table. We are not animals. We discuss the real concerns that we feel can change this policy. It has some part that would be good if they called us on table and we discussed how to change. It's not that the whole policy is bad, but it needs to revise the key things that we are talking about that are raising in the public. Then we also request for formal representation as for us medical students on these decision-making bodies, mostly like the ministry. Couldn't they provide a slot to one, at least for one medical student to represent if they're making these decisions? Because if they had made this decision by consulting any of the students or even our professional bodies, all these problems would not have come. And finally, we request the government to pay all interns without segregation. They have come out and they say that they want to pay those ones that were on government sponsorship. Now that is very, very dangerous to the government itself, to the patients, even to the rest of the other practicing bodies. Because when they come to pay only the government medical, the ones that have been studying on government sponsorship, and they leave out the private ones, yet you're doing the same work, you're being exposed to the same situation. Now it is going to segregate, and actually it is going to increase extortion of the patients, yet they don't want it. It is going to leave negligence, because if I'm not accountable, I'm not paid, and you call me to do something, I will use that you are already covered by the government. So I will not turn, I will not be available to give a service. So with that, medical students remain very relevant in this health sector, and they are future healthcare professionals. Thank you.
Thank you very much. In our thoughts with the thoughts of the Vice President, the Prime Minister, Leader of Opposition, Minister of Health, we don't know which direction they are going to take. But for us, we know the direction we are going to take. Our effort in rejecting this policy, our effort in asking that this policy be readdressed will only come to an end once we see the present pre-interns, all of them without exception deployed, all of them paid, and all of them paid on time. I repeat, we are not going to let down our guard regardless of the statements which are sounding good until all the current pre-interns have all been deployed, have all been paid, and have all been paid on time. I also want to rejoin what my colleague Dr. Jacob said. We have got 300 colleagues with contracts with government whose money was withheld since August last year. This case is in court. We ask that court looks at this case expeditiously, but sound warning to government that these colleagues of ours must be paid, because in our pleadings we want them to be paid, and any time that goes beyond July 30th, they are going to be paid with interest. So it's only if you pay them within July that you can pay them for their 12 months only. But any time that goes beyond the mandatory period of internship, when they did receive their money, you're going to pay them with interest. You can do the math, and of course we know the money is there, you just have to reallocate it. Bananga bannayuganda tubeeyanziza okutuuliriza, n'abannamawulire tubeeyanziza okujja kutwala eddoboozi lyaffe. Ffe ng'abasawo abakola mu Uganda twegasse ne tujja n'abasawo ba pharmacist, basawo ba nurse, basawo ba dentist, naffe doctors, ne twogera n'eddoboozi limu ebintu bisatu byokka nti n'ebbago eryabagibwa okukola ku training abasawo tuliganye kyekisooka, era kino tukirizaganya ne Vice President ne Prime Minister ne leader of opposition ne speaker kino ebbago balizeeyo abalitegeka balyeddize kubanga terijja tukolera. Ekyokubiri, twagala ebbago oba police enakola ku bya internship training byo tugyetaaga. N'olwekyo kino ekiwandiiko kye bawandiise tujja kyaniriza nga draft 0 tutandikiraawo okuteekebejja kubanga ffe tebatukonsultinga, tuyinza okubanga tetumatalinga oluusi tomanya, naye at the end of the day muffwe mwemali ba interns abagenda kukola emirimu eno, muffe mwemuli ba supervisors. Kati fe abagenda okutuukiriza lino ebbago bwemba temutuwebuuzizaako mwebuuziza kwani? Aba university tebababuuza, Uganda Medical Dental Practitioners Council tebagibuuza, National Council of Higher Education tebagibuuza, abo nabo si bakulu. N'olwekyo ekyokubiri kyetugamba nti lino ebbago balirete ku mmeeza, ffenna tulyekebejje, tuggyemu ebitali birungi, ebirungi tubirekemu, ffenna tuse kimu, ebbago lino lisooke likole. Ekisookusatu ate ekisembayo, ekigambo kino internship kirabika kireese obuzibu, naye ekyembi ate abayita mu internship bebatuwulisa bebetwala nga batakitegeera. Kati engeri internship okolebwa buli profession yonna twagala twawulemuuko, tugambe nti bano betuyita ba intern doctors, intern pharmacists, intern nurses, katukyuseemu kubanga erinnya lino olwedde mweliri mu mateeka. Abasawo abakola MBCHB tusaba bweba bakkiriza bayitibwe nga aba junior house officers oba junior medical officers. Abasawo abamaze degree mu pharmacy bayitibwe junior pharmacists. Abasawo abamaze bachelors in nursing bayitibwe junior nursing officers or junior midwifery officers. Kino kinayamba okumanya nti eno internship gye tukola fa abasawo si kyekimu. Ekisooka tugikola nga tumaze okumala course emisomo gyaffe.
And you want to train pharmacists without their license, they should also mandate UMDPC and the National Council for Higher Education to do their work diligently and continue. And obviously, lastly, but not the least, that welfare that they are paying is very small. Because if you look at how much the interns in UK are paid, 13 million per month, South Africa 12 million, Kenya here our neighbors they are paying 7 million. So Uganda by coming out and just paying 1 million, 2.5, so they are just joking, isn't it? But that's the low-hanging fruit that they should not be left to the dogs. Thank you very much.
Thank you very much, Dr. Kaweru. I would now like to invite
And you want to train pharmacists without their license, they should also mandate UMDPC and the National Council for Higher Education to do their work diligently and continue. And obviously, lastly, but not the least, that welfare that they are paying is very small. Because if you look at how much the interns in UK are paid, 13 million per month, South Africa 12 million, Kenya here our neighbors they are paying 7 million. So Uganda by coming out and just paying 1 million, 2.5, so they are just joking, isn't it? But that's the low-hanging fruit that they should not be left to the dogs. Thank you very much.
Thank you very much, Dr. Kaweru. I would now like to invite
that this person is ready to work. So this internship we are talking about, it is equivalent to working. Why? Even when you look at their contracts that are given, they say you are going to work the entire month, and each month we shall only give you 2 days and a half for rest. That means it's already a contract. So for some of the people who have been saying that it's not work, it's already a contracted job. So according to the Employment Committee of 2006, that's already a contract. And if you violate it, actually, breach of contract is equivalent to a lawsuit. So then too, medical interns are not students. That is the other thing. So they are legally allowed world over to practice under minimal supervision. Even me, Dr. Kaweru, who is a senior consultant operating people's lungs, I have supervisors. So they appraise me every year. So what about the young colleagues? So legally, they have a provisional license, and they are suable, they can sue also. That's why you see that when you touch them, then you get a lot of hiccup. So basically, they are recognized by law. And then eventually, when we look at some of the controversies that we are seeing, they are meant to practice with less duress. So many times people know that if you're not diseased, then you are healthy. But also if you are mentally not well, if a doctor comes to work almost 24 hours and he doesn't have food, he doesn't have where to sleep, and he doesn't know, some of these people actually have wives and families. So if they are not sure of where their children will go, it becomes a dilemma. So if you are under the care of such a person, you should get worried. So we realize that actually we should put things right and not allow the government to lead when we are watching. And eventually we come to the welfare and socio-economic impact. If you ask, as they had proposed, that a government intern will be sponsored and a private will not be sponsored, to me as a supervisor, I become at a very big dilemma. How would I get the roll call and say, oh, the intern who was sponsored by government come on duty, and then the other one who was not provided for by government, please don't come on duty. Or if he comes late, what do I do? So we are saying that we should support everybody because they are offering a service. Some of you, these are your children, your brothers, your sisters, your relatives, and surely they leave at 5 or at 6, and sometimes they come back very late or come back after so many days at home. And that is how internship is designed. So we say, and they offer a lot of services, which actually government is not paying for. So government actually is reaping big out of this whole thing. And we want to say that, thank you, the interns, for the good work, and they should continue, and also we ask the government to continue paying. Actually, they should pay them around 75% of what a medical doctor should be getting. That's around 4 million. But if the economics doesn't tie up properly, 2.5 will be a very good take home. Why? If you look at the inflation rate and then the high standard of living, getting a house in Kampala, I cannot afford a house in Kampala here. That's why I went to Mukono and bought very far, we're 25 kilometers. So how would you expect the intern doctor to afford a house of 1 million every month and is earning 1? He shouldn't feed, he should feed. And some of them are renting very far. So that means they have to be transported and they need to feed, eat. You know, I usually say, Mr. President, how does a malnourished intern with no stomach look after somebody with a 1 kilometer stomach? It becomes very difficult. So we say they deserve to be given the food so that they are able to look after the well-nourished person. And you know, Uganda has so many well-nourished people, isn't it? And to look after 50 million people with only 10,000 doctors is very small. And the government actually employs around 25 or 2,500. So let the government actually harvest this bumper harvest and look after them, and they will actually give back in quadruples. They will be like delivering in 4-4 every now, not 1-1. So we want to thank the media that actually should take this advice that government please continue paying for the interns because they give back to the community. 2, they should leave the professional bodies actually regulate training. Yeah, I want to give an example. Pharmaceutical Society of Uganda, you cannot open a school